Hi, I'm Phil Nathan, and I have the privilege of chairing the Sum of the Parts. That's the committee that oversees and coordinates all of the service areas that we as Lions provide to our communities and internationally around the world. Our causes serve areas concerning cancers, vision, hunger, diabetes, environment, disaster and youth, and many other areas actually. But we here in the British Isles have learned to support each cause by way of synergy, which will hopefully become evident to you. So a great team have volunteered an inordinate number of hours to produce for you the Global Service Team Roadshow. These productions have been recorded and will be available for clubs to download and view independently. I'm very pleased to introduce this recording specifically on LCIF, Lions Clubs International Foundation, our mighty global foundation. I hope that you learn from it, and I hope that you enjoy. Thank you for listening.
Thank you for joining us today for the Global Service Team presentation on LCIF and the work it does, and to learn how you can help. My name is Andy Pemberton, and I've been MD Coordinator for LCIF for nearly 4 years. Today I'll be assisted by two District Coordinators, Roy Chambers and Alan Hall, and PCC Stuart Sherman Khan will explain how you can support LCIF Day. Before we continue, let's think about what the objective of LCIF is. It's there to support the efforts of Lions Clubs and partners in serving communities, both locally and globally, giving hope and impacting lives through humanitarian service projects and grants. Now let's move on to a presentation by past District Governor Roy Chambers.
In June 2018, Lions Clubs International celebrated its 50th anniversary. Through generous support from Lions and Leos like yourselves, our foundation has awarded more than $1.1 billion in grants, making enormous impact through countless local and global projects and initiatives. Together, LCIF and Lions have accomplished visible results. Cataract surgeries have saved the sight of 9.3 million people. We've eliminated river blindness as a public health threat in Colombia, Ecuador, and Mexico. In partnership with the World Health Organization, supported the establishment of 54 child-friendly eye care centres in over 30 countries, assisting over 131 million children. Conducted more than 30 million screenings for children through the Sight for Kids programme. Address vital human eye care resource needs through the support of training initiatives in West Africa, Central and Eastern Europe and South Asia. The measles programme, with over 100 million vaccinations completed, resulted in saving the lives of hundreds of children every day. Awarded more than $140 million in disaster relief. We've improved the lives of over 17 million children through the Lions Quest Life Skills programme. LCIF and Lions have accomplished visible and life-changing results. But the impact of LCIF did not stop in 2018. Since 2018, Lions Clubs International has a goal to impact the lives of 200 million people each year. One way the organisation is working to achieve this goal is to enhance service, impact and focus. LCIF will support this goal by increasing its service impact through expanding its core competencies. Through vision, eliminate avoidable blindness by leading the global charge to rid the world of infectious blindness and visual impairment, and improve the overall quality of life by providing service to children and adults who are blind and visually impaired. Supporting youth, strengthen the future by improving youth's access to quality education, vital health services, and positive development programs. Through disaster, empower community recovery by deeply engaging in disaster relief efforts and in preparing for and responding to natural disasters whenever and wherever they strike. Through humanitarian causes, transform millions of lives by sponsoring and delivering programs to support the elderly, people with disabilities, women and girls, orphans, and other vulnerable populations. In addition, LCIF will sharpen its focus on fighting diabetes. Diabetes is a global epidemic and leading cause of blindness, visual impairment, and death worldwide. In service, Lions will help prevent diabetes through multifaceted, targeted, and comprehensive health initiatives. LCIF will reduce the prevalence of diabetes and improve the quality of life for those diagnosed. Lastly, LCIF has expanded its global causes and conducted research to identify the specific areas of greatest need and opportunity within the larger causes of childhood cancer, the environment, and hunger, and has conducted pilot projects to develop expertise and develop sustainable long-term programs on local and global scale. As you can see, the Foundation has a clear impact on the world around us. Though you may be wondering how to translate that global impact into local results. We will now look at these grant opportunities. LCIF grants are available for all our areas of focus: humanitarian, disaster, vision, youth, diabetes, hunger, childhood cancer, the environment. Now let's expand on these areas. Humanitarian grants consist of a matching grant or designated grants. Disaster grants, well, disasters come in all forms, and luckily so do the grants. These grants include the emergency grant, disaster preparedness grants, community recovery grants, and major catastrophe grants. For vision, Most of us, if not all of you, already know about our many Sight First grants. For youth are supported in many ways, most notably through the Lions Quest Youth Development Programme. Several Lions Quest programs are now available. There's program grants, promotional grants, community partnership grants. LCIF also supports youth through the LEO service grants, which provide non-matching grant funding for opportunities for LEOs to assess, plan and implement service projects in their local community. In addition, LCIF has a grant programs to support Lions service in the causes area of diabetes, hunger, child cancer and the environment. Diabetes grants provide funding to help reduce the prevalence of diabetes and increase the quality of life for those living with diabetes. Hunger grants fund capital needs and select operational expenses during the startup period for projects that are focused on alleviating hunger. Childhood cancer pilot grants support Lions projects that provide familial support and improve the quality of life for both the children receiving cancer treatment and their families. The environmental pilot grants to support Lions projects in all environmental improvement areas.
Mobile and Wi-Fi connectivity in rural areas of Wales can be problematic for emergency services, particularly during a pandemic. Working with the UK Space Agency, the Wales Air Ambulance charity developed a concept for a bespoke product that would provide a portable, secure mobile network that could be used on emergency call-outs and in support of field hospitals or other temporary healthcare facilities. Thanks to the grant from the Lions Club International Foundation, the Wales Air Ambulance charity was able to purchase and develop bespoke devices that enhance the vital communications required at the scene of an emergency incident. The device connects to multiple mobile phone networks and provides a secure Wi-Fi hotspot for up to 100 meters around the device. Further connections, such as satellite or wired broadband, can also be connected to improve connectivity. The device, which is now in use across our 4 bases, can support the medical operation in terms of providing a vital connection to our control centre, fellow emergency services and hospital facilities. Thanks to you, the Lions Club International Foundation, we have been able to enhance the delivery of healthcare in our rural communities during a very difficult time. On behalf of everyone at the Wales Air Ambulance charity and the people of Wales, thank you so much.
In West Africa, there are an estimated 2.5 million cases of blindness, and an estimated 90% of these are curable through today's medical know-how, if the specialist skills and necessary equipment are to hand. This is Kolebu Teaching Hospital in Ghana, home to a newly rebuilt Department of Ophthalmology, which incorporates the Lions International Eye Center. The Eye Center is a very cleverly thought out project designed to change the eye care situation in West Africa for good. The main purpose of the clinic is to provide subspecialist training to ophthalmic medical staff.
it's probably the dream for me come true that somebody will come out of the blue to propose a solution to some of our problems that we've been having for eye care in this country. When I came here, I came at a stage when there were only 2 ophthalmologists in this place. I had come from a training which trained you to do a bit of everything. And I quickly realized that there are patients that I couldn't treat at all. Now, for the majority of those people, they just went blind. Those who could afford went abroad. And I've been doing that for all these years, hoping for a time when we'll be able to do everything within the country.
The concept of a specialist ophthalmic teaching facility for Ghana was dreamed up years ago and made possible by a collaboration between the West African College of Surgeons, Lions Clubs International, Korle Bu Teaching Hospital, and Moorfields Eye Hospital in London. The concept to build a home for excellence in teaching the eye surgery techniques of the West in Ghana, a stable location in the middle of West Africa, and share skills in a partnership. Most West African patients cannot afford to travel abroad for treatment, and talented West African medical students are likely to leave the country seeking to learn skills and access technology, then qualifying as medical staff abroad, perhaps never to return to West Africa. So, a key strand in the thinking is training the talent pool of young medical students in Ghana. Once the skills have been embedded, doctors will train each other locally so that the skill remains in West Africa.